Okay, today we're talking about the EZpap. Before we go into the patient's room, I'm going to check the patient's chart, make sure if I need to bring any medication with me. This can be hooked up to aerosol device, and we can do the PAP therapy and administer meds as well. So I'll check the patient's chart, making sure I don't have any contraindications. The patient does need to be alert and oriented to do this, so I need to check about that as well. So upon entering, I'll go ahead and introduce myself to the patient and explain the device to them. So this is the EZpap, and we're going to use this to treat and prevent any atelectasis. So that's opening up your alveoli in your lungs. We're going to go ahead, and this would come all detached here. So we'll connect everything, put it together. If we have an aerosol medication, we'll put this in front, and then that's the mouthpiece. We can have a mouthpiece or a mask with this device. We'll hook up our O2 tubing. This can be hooked up, if we're not using any medication, we can use just regular saline. Or I mean, it can be used just with air. So we can hook this up to air or oxygen. So what we're watching the whole time is this manometer here. We want it in between the pressures of 10 to 20. And the way we would adjust that is we'll start the pressure off or the flow off at 5 liters per minute, and we can adjust the flow accordingly. If we increase the flow, then we can get our patient ranging up into that 15 to 20 marker, which is a therapeutic range for the EZpap. So before I would do, we would do this with the patient, I would definitely listen to their lung sounds, check their vitals, be monitoring their heart rate and, the respiratory rate and any secretions, sputum secretions that we're getting up. And then afterwards, we'll listen to their breath sounds as well, and to see if there was any clearance with the therapy. We go ahead and we leave this in the patient's room. This is a one-time patient use. So we go ahead and leave this in here, and this will stay with the patient through the course of their hospital stay. After we're done, we make sure the patient is secured, that they need anything, have their call light, and come back and do their therapy later. That's it.